People ask me as a surgeon, why do I do injections? Because it's really artistic. It's actually fun. When done well, you create great results that look amazing. So what I've talked about to trainees for the last 17 years that I've been doing trainings is that it's what's as important as the product is the person behind the syringe. You guys are very, very important. It's very, very important that you guys know how to inject, who to inject, and how to do this safely. So assess a face by looking at 3 zones. And I would actually say it would be 5 zones. Upper, middle, lower, and also neck. And also extending to what is called the décolleté, the area above the breast, okay? There's a whole area that we look at comprehensively. And if you look at it comprehensively, you can get results that are far better than just squirting some stuff in people's lips, okay? Comprehensive results far outweigh monotherapy. So some people call it the heart-shaped face. I talk about visualizing the V. It starts with the chin point, it goes out to the light reflecting points, includes everything within, but also it includes everything laterally as well too. Chins can actually be very, very powerful because what they do is they create a little stronger jawline and they lengthen the jawline as well too, all right? And that especially helps if we're looking at treatments such as like a Kybella or anything that's going to reduce the fat in the neck and create more shadowing as well too. Men like to have broad jawlines, more squared off jawlines. Women, for a more feminized, youthful face, like to have a little bit more of that, not concavity, but a little narrow jawline, okay? So how do we age? Bone. We're putting filler on bone because we lose bone, but some bone actually becomes a little bit bigger. Our jaw gets a little bit bigger in certain areas. Our orbit actually widens, okay? Pulling the muscle down and creating tear troughs, okay? So we need to know how the bone ages. You've got a facial artery that comes up, becomes the labial arteries. Labial just means lip, okay? You have an upper lip and a lower lip, so guess what? There's an inferior and there's a superior. That vessel tends to sit deep. Okay, so when you're injecting the lip, inject it superficially. Because a lot of times injectors will come up and they'll say, you know what, you just inject here, you inject here, you inject here, and you inject here, okay? Know what you're injecting above, okay? Because there's a lot of variability, and again, there's a lot of stuff that you could get into. And so always aspirate.